Thank you. And so thank you guys for having me. I will say that in seeing your comments early on to Julie, you guys are just one of the most welcoming groups and so supportive. And so which made me very excited to be presenting and help to calm my nerves a little bit. But I just wanted to talk about what are some ways that we can now address the disparities, the racism that we see, and how can we do that within healthcare education. And so, I will say I was just incredibly lucky a few years ago to be invited to take on a role in the Group on Diversity Affairs, which is our diversity office within the College of Medicine at our institution. And, in the beginning, I will just say kind of a personal story was that my husband and I had been really thinking about moving. So we're originally from Maryland, and I came to South Carolina for residency, and we stayed. I've really loved Charleston. And then just some of the cultural societal climate, not just necessarily in Charleston, but just in the country. We really started thinking like, well, maybe with having a son who is biracial, like maybe the South is not the best place for us to raise him. And so we had thought about moving back up to Maryland. And then around that time is when I was invited again to take this role to be assistant dean for resident inclusion and work in the diversity office. And it was really, pretty amazing. I work in an already wonderful department, but this wasn't a topic of conversation. And so being with people where we just could openly talk about some of the injustices we were seeing, or honestly, more importantly at the time, what we were talking about is like, how do we support our URM, our underrepresented in medicine students and residents, and then hopefully retain them as faculty. And so there was just a lot of positivity around race and diverse healthcare professionals, and it was amazing. I mean, it was just such a great experience, and is still a great experience. And I'm really just so fortunate to work with all of the people that I do. And when I started, they already had so many wonderful pipeline programs in place. And so as I talk to you today, again, we work within the College of Medicine and have kind of a spectrum of support. But I'm going to tell you about some programs that are for medical students that could easily be translated into resident education, but also some that are, we do utilize directly with residents. And again, the hope is that, we create this diverse group. But I think for the purposes of this talk, what I want to start by saying is something that Catherine has already said, which is, really taking a stance. So the first thing that I think you can do at your institutions is to take a stance and be, again, take that anti-racism stance. Not just, oh, racism isn't good, but actually, what are you going to do about it? Like, and I think you making that comment shows support to those around you. And another thing, and I think is just so important that Catherine said is it does not always have to be that you have to be a person of color. And what I really want to kind of drive home is that it actually is better in some ways, right? Because we can't do it all by ourselves, and we need people to say like, this isn't just a problem for people of color, it's a problem for society. And I think that having people of all different backgrounds show their support actually just helps to build the cause. And one of the things I like to say is we're called underrepresented or minorities for a reason, because there are far fewer of us. So we need the majority to come out and say, yes, this is wrong. We are going to take a stance against it, not just that we're turning a blind eye or feeling sad that it's happening, but say like, no, how can we help? And so do not feel like, I don't want anyone to feel timid that they are not in the place where they're allowed to say something. And sometimes, again, you saying that, like making a stance, helps you to bond with others, and they say, okay, this is someone who's a supporter and an ally. And so I really, again, just want you to feel confident in sharing that, and don't feel that because you may not be a person of color that you can't share your position. So talking about that, so first just making that stance, what are some of the other things that seem to be important? So again, within the College of Medicine, we have pipeline programs. So one of the things that I think is most important is to have, and this is again pre, all of the riots and things, but we were always focused on was representation, and that is important for so many reasons. That is important so that if you have students, they say, "Hey, I would like to be a resident here because I see a diverse faculty." If you are a resident and want, considering your future career, we want more underrepresented in medicine physicians in academia. There is a very low percentage. I believe it was maybe 4%, and so very low. And so we're trying to say, like, hey, if you see people who are like you, that tends to help you envision yourself in that scenario. And in particular, mentorship is so important. And so I know Catherine is working on something, is actively working on a program for mentorship, and it's huge. Students and residents routinely tell us that they care that there is someone who looks like them at the institution they choose to train. And so we survey our graduating medical students. And as of a couple of years ago, started also surveying our graduating residents. And I should be specific, graduating URM, so underrepresented in medicine, medical students and residents, and ask them a series of questions, anywhere from tell us about the environment. So we'd ask them, had they experienced racism? Had they witnessed racism? And then on to questions such as, okay, so as you were applying for residency, was it important to you that you saw someone who looked like you? Did you see someone who looked like you when you interviewed? And what we were trying to figure out is, how do we take the knowledge that they, their experiences, how do we then translate that into our mission, which is diversifying our medical school and diversifying our residency class? And so I would just say to all of you, anyone who is, involved in residency education, that if you could take something back to your institutions, I would absolutely say representation matters. And so, yes, we want, diverse residents, but I will tell you, most URM residents are probably going to be looking at your website to see if there's anyone who looks like them. And so I tell our residency programs, hey, you have lots of people of color in your program. Put that on the website. Like, put their pictures up, because people do care. And they want to, feel like when they look at your program that there's someone like them there. So taking that, again, it's as simple as sometimes just having the pictures on the website. I have students who tell me that when I was applying to residency, I looked at that. I looked at the pictures on the website. So that's a very simple thing. Then, when you have people interviewing for your program, you want to see those people in person. And part of that is that if you are someone who is a person of color, you may feel more comfortable asking questions about what it's like to be at that institution, what it's like to live in that city, of someone who understands, what that means to you, right? So it's not the same for all of us. And so try to link them together on your interview days. And even virtually, we've changed one of our platforms to having, we have resident diversity hangouts. And so our URM residents host sessions once a month so that underrepresented and medicine applicants can sign up and meet people who look like them and ask them these questions in a safe space. It's just other residents. And we do this outside of the application cycle, or outside of the actual interview day for the program. So again, this connection is so important. So trying to facilitate that is huge. So the first thing I would say is start with representation, and I understand you might say, well, you know what, we don't really have that much representation now. What do we do from there? And so that in that case, you need to show that it's important. And so that could mean going to SNMA, so Student National Medical Association, going to their annual conference and talking to URM students about your program so that they know it's important to you, that you really want diversity represented in your program. So again, a few things just to keep in mind. having application scholarships. So if you have a visiting student, we have a visiting student program where URM residents or applicants, medical school applicants in their 4th year, when we were doing visiting rotations, obviously in COVID times, that's not happening. But there was actually a scholarship, a stipend that URM students could receive to travel and visit your institution. And when they came, so not only did they have that incentive with the stipend, but the group on diversity affairs, we would meet with them and we would ask them, like, what are your questions about being in South Carolina? Like, or let us tell you about our experiences, because we are from some of our group is local and they've lived in Charleston their whole lives, and some of us are from, you know, various parts of the country. And so just kind of that extra connection is something helpful. So considering something like that. And then, you know, the other thing that I would think about is general support. So once you have those ways of meeting, you know, meeting a diverse group of students and recruiting them for your program, um, then once they're there, you know, what would you like to implement to show your support? So again, Catherine talked about this, having sessions where, you know, where the student or the residents, I'm sorry, could share kind of freely. And we did that as well. And so we had a forum that was hosted by residents. We have a group called McLennan Banks, which is our network of underrepresented residents. And there's a leadership board. And right after George Floyd's death and the riot started, they reached out immediately and said, we need to have a town hall. This needs to be discussed. And within 3 days, it was set up. I mean, they were so adamant about this happening. And, you know, and it's funny because they were just amazing. And they had people from around the country participate in this in all different healthcare fields. And it was just amazing. And they offered it to the whole university. And I could not believe within like a 24-hour turnaround of them announcing it to the actual event, I believe we had almost 200 people present. And it was just a really honest discussion about what it means to be URM. We had allies, so it was not all URM residents and physicians. We also had white residents and white physicians. We had nurses, we had lawyers and people who worked in kind of policy. And again, we really wanted to be diverse and welcoming to everyone and show how important allyship is. But having that space was really important. And it was pretty amazing to us to see how many people came and how many leaders within our institution came to this forum. And so thinking about things like that don't have to be on a big scale, can be small groups. And I will tell you that some of our students in particular really wanted a small group. They said, you know, it was really nice that you had this large forum and had all this representation, but we just need to be able to talk to you in a small group, and to you meaning the group on diversity affairs. They wanted just, you know, our mentoring program that we have. They wanted the mentors and mentees to meet, and that was it, so they could share their experiences. And so again, it doesn't have to be huge. I think just having those small sessions is really important. It was mentioned earlier that we are currently creating an anti-racism curriculum, and that this is easily translated into residency. And in fact, we in our department have met to try to take some of these topics and incorporate them into our residency curriculum. And so the topics range, you know, so for family medicine, we are focusing on preventive medicine, so how screening disparities occur and how we can remedy those. Pain management. Of course, other specialties are looking at things such as access to care in mental health, maternal fetal mortality, which again, all these things easily fit into family medicine because we're such a broad spectrum field. But, you know, having that space to incorporate that into your didactics, having a book club, we've incorporated that into curriculum, and I actually couldn't believe the conversations we had. They were amazing. When people felt they had a safe space to share, they just really opened up and talked about how they felt. And we even did this with first year medical students. So within a week or two of knowing each other, we had them read chapters of a book Fatal Invention was the book we had them read, and have small group discussions. And they, I mean, just again, were so open, and they barely knew each other. And one of the things we really prefaced with was that it was a safe space. So a lot of the things you guys said in the beginning of, we're here with gratitude and we want to learn from each other, and kind of share without judgment. And I mean, it really was just such a beautiful thing. And I would encourage you to think about those things as kind of an easier way to talk about these topics within the context of a book, but still very important. The one last thing I want to share is for providers, healthcare providers. So we know there's data out there that says, thinking about, again, diversity and all these things, like why is it important? We know that there's data that shows that when providers look like their patients, there are better outcomes, meaning they're more likely to accept preventive screenings. They're more likely to follow up and get an A1C check and those kind of things. So that's one reason we want to diversify our classes, is because we know that it is important. There are a lot of other reasons, right? But that's one thing that is important to consider. And if you are in a program that is not particularly diverse, or certainly we don't look like all of our patients. And so one of the things that's really important, and that was really great that I took from a podcast called Hidden Brain, that talked about people like us, was that even if you don't look like your patients, how can you help achieve better outcomes? And part of that was really just getting to know the person. So asking them about their family and their lives. And I'm sure for a lot of you are like, I do this all the time, and that's amazing. But maybe teaching those residents who you're working with to do the same thing, and creating that bond seems to make a big difference. And so I think I've taken up all my time, but thank you guys for letting me share.